I'm Dr. Lydia here at Vibrant Life Direct Care to explain our Vibrant Rejuvenation Facelift. Have you desired to have a minimally invasive, natural enhancement of your face that would improve fine line wrinkles, the texture, color of your skin, and also give it a little bit of a lift? Well, this is the procedure for you. Let me explain. So this is a little bit different than our facial in that these are all injections. They're injections of strategically placed Juvederm across the face, followed by injections of platelet-rich plasma. The reason that we do that is because Juvederm normally lasts about 8 months, and then the body completely resorbs it and you have to reapply it. Using platelet-rich plasma behind it and only using Juvederm as a scaffold allows the platelet-rich plasma and Juvederm to cause an immediate enhancement, but as the Juvederm fades, platelet-rich plasma is there in that scaffolding, causing all the local fat cells in the face where we've injected it to hypertrophy and fill in the ditch so that you have really good natural looking skin growth in those areas, which revolumizes the center of the face where women show aging first. So let me go through the procedure. So if you're not familiar with platelet-rich plasma technology, first of all, if you are familiar with getting your blood drawn at the lab, the first step after we draw whole blood is to run it through a centrifuge and separate out the red blood cell layer from the plasma layer. That's the liquid portion of the blood that also contains all of our regenerating properties. This is what heals our skin or any wound in our body and allows all the layers and all the local stem cells to regrow every bit of tissue that was there before. We take this top layer off and we put it in our FDA approved centrifuge, and we spin it down a second time to really accumulate most of the growth factors and the platelets in the bottom portion of this. We discard the top, and then what's left behind is what we use for our platelet-rich plasma injections, okay? And in this case, it'll be applied to the face. Let me show you where we apply our injections generally. So there are safe spaces on the face to apply Juvederm. Juvederm's biggest risk is that it can cause occlusion of small blood vessels, and that can cause tissue necrosis. So we want to be very careful about where we apply Juvederm to the face. So generally, we first start with the cheeks, and we plump up the cheeks, the apples of the cheek, kind of like raising a sheet up. We'll tint up the tissue. That's exactly what we're doing here. The second injection is here at the eyebrows to raise the lids just a bit. The third injection is into the bottom lip, and the fourth is into these marionette lines here at the bottom. Then we come back with our plasma and we inject the other places that Juvederm's not so safe to inject, like the tear troughs here in the eye. If you have any dark discoloration under the eye, we can correct that. The nasolabial folds, these marionette lines here underneath the lip. These are the places that we apply PRP, which immediately causes Juvederm to plump up, which could otherwise last a few days if it was just Juvederm. So the aftercare for this procedure, again, since it's not microneedling, there is swelling and there's always a risk of bruising. So before you come for your procedure, we ask that you not take any aspirin, ibuprofen, Aleve, or any products like that to reduce the risk of bruising. But the aftercare is just to allow the immediate swelling to go down, which should all be gone within 3 days. And then any bruising will quickly subside in the amount of time a normal bruise takes to go away. And then we ask you to just avoid sleeping on the face. Juvederm, once it's placed, is pretty solid, but this Ultra XC is moldable, so we ask that you not sleep on either side or on your face for the first few days. And otherwise, you can go back to normal activities immediately after the procedure. The effects of this continue to give enhancement at 30 days, 90 days. And most people who do these procedures will say it looks really the best at 1 year. I've had this procedure done. I went 20 months between treatments or touch-ups, and I love the effects on my face. Everything looks very natural. and I feel like it's a procedure that I'll continue to do to keep my skin looking healthy and young. So if there's any questions that you have about this or you want to get on the schedule, please give us a call here at Vibrant Life Direct Care. Thanks.